welcome to Let's Just Do This, the show where we bring change makers to the table to challenge your belief systems and help to empower you through education to become the CEO of your life and health. My name's Margaret Wallis-Duffy, and I'm thrilled to be here, as I am every episode, with my great co-host, Mr. Todd Miller.
And co-CEO, I might add.
And co-CEO,
Yes.
indeed. You
Yes.
are indeed. Now, you know, we love coming into studio to bring different people to the table, to hear about their stories, their passions, and of course, their expertise to help you and your family live well. Today's kind of extra special for me because I get to interview, or maybe say, have a conversation with what I can now call a colleague, a friend of Wallis for Wellness. I am so honored to be bringing to Let's Just Do This and to all of our listeners and viewers, Dr. Nelly Naguib, who is a naturopathic doctor, but is also a graduate of the Ain Shams University Medical School in Cairo. She is a physician as well. She's also trained in acupuncture and Bowen therapy, and now she is a member of Wallis for Wellness. We are so thrilled to have you with us, Dr. Naguib. Welcome.
Thank you so much, Margaret. Thank you so much for this beautiful introduction. I really love it. Thank you.
You're welcome. So, you know, one of the things I love about what we do here is to really talk about why people do what they do and how they came to where they are in their lives, because I really do feel that it tells a bigger story. It shows where your passion comes from. You told me that you come from a long line of doctors, but I want to hear, how do we, and I love the fact, you know my passion for integrative health, it is your passion. You are a medically trained doctor, both in Egypt, you passed your exam here in Canada, but then you also went back and became a naturopathic doctor.
Yes.
And you haven't looked back.
No.
And you said to me, nobody can take my medical degree away from me,
No.
but I now have more to share. Tell us where it started in Egypt, maybe a bit of story about your family and why you wanted to become a physician and how you got here today.
Thank you, Margaret. This is my passion to share, and I really love to share it with everyone. As you said, my name is Nelly Naguib, and I am a medical doctor and naturopathic doctor in Canada as well. My passion to medicine started very, very young, when I was just 8 years old, having two-parent physicians at home all the time, helping everyone around. And you see how people like say thank you and thank you, you know. And when my dad go to church, people will come to him and he will not ask for anything but helping others.
Right.
So this has created a passion to help others since I was young. And a very young child like that, my dad has a stethoscope. I said, oh, that would be a cool profession to do. And yeah, so I decided to be a medical doctor very, very young when I was just 8. And I studied hard and I passed I was top of my class, and then I reached the high school. And the medical school in Egypt, you go after high school. You don't have to do undergrad like North America, so it's easier.
Right.
So you finish your medical school and now you're happy being a physician. But when I was in my internship, I said, I can't help my people as I want to. Just medications that I know. I don't know lifestyle. I don't know how to teach them about nutrition. I don't know how to tell poor people they can't afford money, how to cook at home.
Right.
So I found there is something missing, but I didn't know what, since naturopathic field is not actually known in Egypt. But as part of our background there, we know how to work with herbs, we know how to work with spices. It's part of our culture. Like if you are sick, just take chicken soup, or
Right.
when you have this headache, just like take a cup of coffee, you know, things like that. So I did have the awareness of natural system, but I didn't know how to know more about that. When I immigrated to Canada, I didn't know any other path, so I decided to pass my exams as a medical doctor here. I passed all of them, evaluation Q1, Q2. I'm a licensed of the Medical Council of Canada, and I passed all my provincial exams. But I reached a point when, okay, where will I work now?
Right.
Ontario was very hard to work in. So the only way is to have a residency or ready to practice is to go to a different province.
Right.
For me, this was a challenge because I did have 2 young children at home.
Yes, yes.
So as an Eastern mom and doctor, I said, okay, my family first. So I sacrificed my medical career and I said, okay, let my children grow. on my way, I said, okay, I want to help them like I used to help them before. So I cannot prescribe medication to them. So what will I do? So I went to the natural stores and I started to find alternatives to what I used to give them. Like instead to go for Advil or Panadol or something for fever, let's work with water, let's work with essential oils, let's work with herbs. So I started to switch a little bit by a little bit from being a pharmacology-oriented person to more like an open-minded person.
Oh, amen. And we are both, both of us will agree. We've had a really amazing conversation in the clinic about this. We're not here to knock pharmacology. There is a time and a place for it.
Yes.
But I truly believe, and as do you, that it can't be the first line of defense and it shouldn't be the only go-to. And it's not the fault of physicians. Their training, as you so eloquently just said, doesn't give them ample knowledge in nutrition or herbs or any other hydrotherapy or essential oils. They don't get that training. So thank you for sharing that. And I just wanted to clarify for our viewers that there is more than just pharmacology, but we're not saying that pharmacology is bad. And that's what I love about the fact that you're both a naturopath and a medical doctor.
Well, the point is pharmacology has a place.
Yes.
But it has to be used properly. Like, if a patient really needs his antibiotic, he should get his antibiotic.
Yes.
But if he doesn't need this antibiotic and he can work out with something different because it's not bacterial infection, it's something different. So patients have to open their mind to try different venue. And this is what I learned in Naturopathic College.
Right.
I learned nutrition, I learned acupuncture, I learned homeopathy, I learned all sorts of stuff. But I also took my education to a more degree that I liked classic homeopathy. I took my diploma of classic homeopathy from the Homeopathic College, Canadian College of Homeopathic Medicine. And I'm really proud of being their student because they taught me how to get results with homeopathy.
Right.
And I also stumbled upon a very fascinating modality. It's called Bowen therapy.
Bowen therapy. Have you heard of it, Todd?
Absolutely not, and I was curious.
Yes, and as a massage therapist and owner of an integrative clinic for 27 years, I certainly am, but I'd love for you to share with the viewers, what is Bowen therapy?
Bowen therapy is actually, we say it is a physical homeopathy.
Right.
Like when you homeopathy, you give remedies, and the Bowen therapy, you apply gentle touch with a very gentle rolling of the hand on the fascia of the muscles to create a deep influence and impulse to the brain to heal itself. We understand that our body is very smart and knows how to heal and in which order. So we give the first session of homeopathy on the whole body. We start by grounding point on the lower back and then work lower body and then upper shoulder and then middle back. And then tell the people to drink lots of water. This is detoxification for them. And people, some of them feel instant result on table. It doesn't feel like they feel, first of all, they feel relaxed. Mm-hmm. What Bowen therapy does, it works on the autonomic nervous system.
Yes.
Everyone is on a run mode. Everyone is flight or fright mode. It's just we need to calm these people down.
We need to calm the people down. And you know what? We can laugh, but we're laughing because because we all relate.
Yeah.
And I just want to interject there, Nelly, and I don't want to get off your stream because I love the way you're sharing so authentically and so naturally. Is it different? Have you seen a difference in North American society with this constant pressure, fight and flight response? Or was that that way also in Egypt? I'm just curious. Are we here in North America stressed out of our minds? And you're right, the autonomic nervous system is really struggling as a result of it.
Well, I believe the world now is in a crazy mode.
Yes, the world. Yeah.
Everyone is stressed. Everyone don't know how to align their body properly. Yes. I believe in mind, body, and soul balance.
Yes.
If we don't align this triangle together, the body will fall apart somehow.
Yeah.
If we don't give enough time for our soul to align with the source, the mind will be always struggling with all these ideas and thoughts and challenges, and this will reflect back on the physical body.
Absolutely.
So it comes on as a unit. Our body is not just a physical body. It's a unit of immaterial things, which is our soul, and the material thing, which is our mind and body.
Yes.
That should be balanced. People don't give time for the soul to nourish. They always work on the body level or the mind level. That's why everyone is struggling. That's why chronic diseases is increasing like crazy. That's why people don't find a happy place
Yes.
to calm down and be satisfied and nourished.
Yes. You know, we've talked a lot here on Let's Just Do This about the mind-body connection and also about finding ways, whatever that means to the person. When we talk about soul or spirit, you know, it doesn't necessarily have to be a religious connotation.
No, it doesn't.
Is about connecting to the greater source and being and allowing ourselves to calm our mind. We've talked a lot about mindfulness. I certainly have seen, you know, 27 years of laying hands on people. The mind and body are connected, and our bodies are a house for our emotions. And if we don't take the time to stop and to be mindful and to allow, as you so eloquently said, for the body to start to heal itself, and we're just on overdrive, sympathetic overdrive, that's when disease happens. And despite the incredible advances in medical technology and the amazing work that many healthcare professionals are doing, people are getting sicker and sicker. And that's why I love the work that you're doing, that you're bringing all of it together and helping to empower people, because you believe they should be part of this.
It is.
Yes.
And the message that I'm getting very crystal clearly is that it's about prevention versus dealing with it after the fact. By having that triangle in harmony, you're preventing a lot of this stuff that we need to rely on pharmacology and other radical surgeries and things to correct.
Yeah. And this is what Bowen therapy started to do. What happened is, you know the on-off switch program of your computer?
Yes.
This is what happened. With Bowen therapy, we do switch off the sympathetic hyperstimulation, and we'll switch on the parasympathetic stimulation, which is the healing mode of our body. Our body heals in the parasympathetic mode. It sleeps in the parasympathetic mode. It digests in the parasympathetic mode.
Yes.
That's why all the stress comes when people are overstressed.
Yes.
Sympathetic, hyper, and don't calm down. Like sleep and wake up with alarms, while you should sleep and wake up without an alarm. Because
that's possible.
Yeah, it is possible.
Yes, Todd.
Okay.
It is possible. It's possible to sleep and wake up on the time that you want without having an alarm to wake you up.
There's something called the circadian rhythm, and there are many things that really impede that natural circadian rhythm. You know, we've got so much to talk about. I'm so glad, Nelly, that we started this episode today talking about your story, how you've gone from being a medical doctor both in Egypt and here in Canada to now also being a naturopathic doctor, and bringing both of those together. So I hope you're going to stick around.
Yes, I am.
Because when we come back after a short break, we're going to talk about some of Dr. Naguib's really areas of focus: pain, women's health, gut health, which is so important, and something that's related to that, your skin health. So stay tuned. We're going to be back in just a minute with more here on Let's Just Do This.
Welcome back to Let's Just Do This. I'm Todd Miller, along with Margaret Wallis-Duffy and our wonderful guest, Dr. Nelly Naguib. So I want to ask you quickly, before I get to my real question, what did your parents think about your desire to be a doctor? Just curious. Did they want you to be one, or did...
No, my parents didn't want me to be a doctor.
Really?
Yeah, themselves. My mom was an anesthesiologist and my dad was a dermatologist. To be a doctor in Egypt is just difficult. They see lots of hassles and, you know, people in accident, and, you know, they don't want their children to go through that path. So my mom wanted me actually to be a pharmacist.
Right.
I told her, no, I want to be a doctor.
I also ask because in your bio, it states that you've experienced a lot of pain in your life, and your parents were trying to help you as best they could as traditional doctors with pain management. And it's something that you've really become passionate about.
Yeah.
Can you talk about what you've envisioned for pain management moving forward?
Okay, what happened is, since I was very young, I inherited migraine from my mom. So when I say, okay, I have headaches, she will only, okay, take aspirin. And then afterward, aspirin didn't work. So I had to upgrade to something higher. And then afterward, I had to upgrade even more. Because, you know, with pain medications, there is kind of tolerance. You try one medication, and then it will take its time, and it will not work. So you need to upgrade to a higher level medications. So I upped to a level of taking migraine, which was one of the highest, most indicated for migraine treatment. And even this one, when I was in medical school with all the stress, exams and all that, it did not work for me. And I was relying on medications. I eat chocolate, I get headaches. I go to, before my period, I get headaches. I go to an exam, I get headache. It was something that really handicapping me. I will have headaches 3 days a week. And I forgot the time when I don't have headaches.
I'm so glad that you asked that question about, why she's so interested in pain management when you've experienced pain. And many of you know my story, and chronic pain is something I lived with for a decade and a half. And not only does it impact every aspect of your life, mental, physical, emotional, spiritual, financial, sexual, it also impacts your family and your friends watching you suffer and feeling helpless. Hearing your story and with migraines, and there's so many migraine sufferers out there, where it literally hijacks their life and their ability to have joy, isn't okay. So let's talk about, some of the strategies integratively, and sometimes it's going to be in combination with medication for some people, but there are other options to consider.
That is.
And let's talk about those options.
Okay, I did the hard way before knowing naturopathic medicine. I did the detox the hard way. I stopped medication when I got pregnant because I cannot take this kind of medications if I'm pregnant. So I decided, no, I will wash off my body the hard way from all these medications. But now I learned how to do it for people gently.
Nice.
We can work with nutrition plan. We can see sometimes the headaches is all about food sensitivity to something. It could be something that you can eliminate from your diet that can help you with your headaches. The way of sleeping, the way you help, when you're stressed, this headache increase by itself, even if you don't have migraine, if you didn't inherited migraine. How to handle stress, how to eat properly, how to sleep properly by itself can help people improve on their headaches. On the other hand, there is other modalities that can help with headaches as well. We can help with detoxification, like cleaning the body from all the junk they had all the years. And we can do this on a maintenance level. We can start and then do it again in 6 months or another one in 1 year. Keep the body always clean, because whatever you eat, pollution is everywhere. You need to keep the body clean. And it's hard to just go on clean diet, because even what we say clean diet is not 100% clean.
Absolutely.
Yeah.
Yeah, our food supply, we can do another entire show on that, unfortunately. And it is a business, right? It is a business, and unfortunately, our food is medicine.
Yes.
However, it's making a lot of us sick, the way we're eating or the way we're not eating, which is so important. You're also trained in acupuncture, and you also talked to me about the importance of the breath. These are all tools as well, correct, that we could be using? Yeah,
this nutrition, acupuncture, homeopathy, Bowen therapy, and you name it. And I also learned the psychosomatic energetics, which is sometimes emotional blocks can help prevent healing. When you remove this emotional block that sometimes is in subconscious, it's not even on the conscious level. When you clear this, people feel better. So when I learned other stuff than pharmacology, I said, oh my God, my toolbox is big and I can help people as they want. If they don't like needles, there is other ways. If they like needles, there is acupuncture. If they don't want both, there is nutrition, there is this and there is that. There is lots of options. And I'm learning even more, because when I started going into the natural medicine, I will say ocean, I like swimming.
Yes. Water is good. Hydrotherapy is good.
Exactly.
It's healing.
So I like even dive more in more modalities, opportunities, how to help my people even more, because my passion is just to eliminate people's discomfort altogether. I don't want people to suffer.
You know what?
And if I can do it, everyone can.
Todd, you've talked on this show, and as have I, the impact that trauma and post-traumatic stress can have. You've candidly and authentically and vulnerably shared your story here on this podcast about post-traumatic stress. As a therapist, I've seen the fallout of that in the physical body. And often, and I've said this, I remember when I was first learning massage therapy and treating someone, I thought, because I was a science girl, and you have a muscle spasm, I'm going to treat that muscle and we're going to fix it. Look at me with my cape on. And the body and the universe has a way of teaching us. And very early in my career, before even writing my government exam, I had a young woman who had a very traumatic event, which I'll tell another time on this podcast. But her body physically started to change under my hands. And what she blurted out of what the trauma that she had sustained, when we were finished that treatment, her musculoskeletal pain was gone. It had nothing to do, well, it had something to do with the treatment because I had a laying on of hands that allowed her to actually release that emotional block.
Yeah.
And I thought when they were talking about emotional release, I was writing my grocery list at the back of that lecture because I thought people were crazy. What is this?
It's woo-woo.
It's woo-woo. And then I actually witnessed in action. And now I've seen that for 27 years, and it doesn't matter what age you are, what status you are. It is not a weakness. It is the incredible, imperfect way that our body works.
Yes.
And we can't get away from that. And you've seen the impact that emotional health can have on our physical well-being.
All the time, every day. It's a constant reminder that it's all connected. And it manifests itself in so many different ways.
Yeah.
Referred pain, eating disorders. There are just so many.
Yeah.
And I just wanted to bring that up not only because it's so important to have a male perspective. That's why I love that I have a co-host like Todd, because you also bring that side to it, and you've been so vulnerable and real on this show, which is what our mandate is here at Let's Just Do This. So, I want to go next into one of the other things that you're really passionate about, and I happen to be too, not because of my own experience, and that is gut health.
Yeah.
Now, we know the science is showing, and every day more and more science showing that this is the second brain.
Yes.
And that really our health begins in the gut. Yeah. My story, which many of you know, I had a poop transplant. Yep. And it saved my life. I had a hospital-borne infection that almost killed me, literally. Thousands of dollars of antibiotics that were making me sicker and sicker and killing the good bacteria in my intestine. And the only thing that got me back to health was having the fecal matter of my son be my donor and it be reinstilled into my body. And now there's been research done, and there's a poop pill, and there's been all kinds of things that have happened over the last 10 years. How important, Dr. Naguib, is our gut health? It is critical, is it not?
It is very, very, very critical for the health of the whole body. I believe if the gut is not healthy, all kinds of disease will manifest. You will have gum disease, you will have skin disease, you will have heart disease, you will have neurological problems, every sort of
Mental
things.
health.
Mental health, everything, you name it, because gut is number one. And embryologically, the gut, the skin, and the brain are connected from the same embryological origin. So we cannot control the brain very much, but we can control what we eat and what we drink. And our skin also, when the bacteria flora, like you said, is not in balance, we have someone else living in there. It's called the candida.
Yes.
And when the candida go out of proportion, it will start to manifest as sugar craving. People will start to eat more, start to eat more and start to get big, and they don't know why. They go eat sugar like crazy. The more they eat sugar, the more the candida will grow. And it might also manifest in the skin as pityriasis versicolor, or called the tinea, that will appear on the skin as well. We cannot kill candida because it's part of our body, but you need to put it under control. Right. Under control is by gut health. Yes. And by increasing the good bacteria to overcome the problem of the bad bacteria that we have, or the bad fungus that we have that's living in. It's not bad, it's part of our symbiosis, our working together thing. But anything that doesn't go with the balance, it go out of balance and problems will happen.
There's been a lot of research done recently, and one of the top cardiothoracic surgeons in North America is doing some amazing research. And I'm talking through Harvard and Yale, and he's a world-renowned, Dr. Grundy, on leaky gut. Yeah. And the impact that's having on your joints, on mental health, because our happy hormones are made in our gut, on inflammation in the body. He's a cardiovascular surgeon. So I just listened actually to his podcast this morning, and so I love to hear, as you're saying, and as he has said, and as the research is supporting, that we can have some control, as Hippocrates said, let food be thy medicine and medicine be thy food.
Yes.
It does have an impact on our gut health, but please don't underestimate, if your gut isn't happy, you're not happy.
Yes.
Right?
And
So
the whole body is not happy.
our whole body's not happy.
Yeah.
Yep, absolutely. I can totally understand that.
Yeah, and when we sit at this table at Let's Just Do This, I'm always looking for options for people to consider to feel empowered. And
Yeah.
that's what I love. When I'm sitting and listening to you, Nelly, you're giving option after option after option. If you don't like needles because you hate acupuncture, well, that's okay.
We
We've
got
got something
something
else. We've got microcurrent point stimulation therapy. We've got homeopathy. We've got, there's so many ways that we can look at this. And what I love about the work that you're doing is that you're also willing to link arms, because you are a medical doctor, with other medical doctors.
Yes.
To bring together a team, your integrative health team. That's what this show is about, to help you create your team so that you can live well, mentally, physically, emotionally, spiritually, and even financially.
I love how we always talk about having a toolbox.
Yes.
We now have an ocean full of tools, according to
We
Dr.
do.
Nelly, which is great.
It is. And you know what? We always run out of time here on the show, and it has come to that time again in our episode where we have to say goodbye. But I wanted to thank you for coming into studio. I am so excited and so honored to have officially welcome you to Wallis for
Thank
Wellness.
you.
We've got great things coming down the pipe. Integrative pain clinic in collaboration actually with an amazing medical doctor, integrative medical doctor from Oakville Trafalgar Hospital, Dr. Reemath Thapper, and a whole bunch of our team. Really innovative stuff. So you're going to stay tuned for that. Will you come back on the show sometime soon?
Oh, yes.
Absolutely. Good. If you want more information about Dr. Nelly, you can go to drnellynaguib.com, or of course you can go to wallisforwellness.com. And of course, here at Let's Just Do This in Your TV, we always want to hear from you. Follow us on all the social media channels. Catch us on Facebook and Twitter and Instagram. And of course, you can listen to us on all the platforms, Todd.
Everywhere. iTunes,
Spotify.
Android, we're everywhere.
SoundCloud.
Yes.
We are everywhere. But most importantly, we want to hear from you. We want to know who you want to see sitting across from us and what you want to learn, because the most important thing is that you need to be in the center of your health, and we're here to help support you do that. So until next time, from Todd, myself, and the entire team here at Your TV, and Let's Just Do This, be well.